Cancer. It's a word that strikes fear in the hearts of many. It's a complex world with over 100 different types, each with its own unique characteristics. However, understanding the basic categories can empower us. We'll focus on the 5 main types: carcinomas, sarcomas, leukemia, lymphomas, and melanoma. These 5 types represent the majority of cancer diagnoses. By understanding them, we can better grasp the challenges we face and learn how to fight back. This journey starts with knowledge, and that's what we aim to provide.
Carcinomas are the most frequently diagnosed cancers, accounting for a significant portion of cases. These cancers originate in the epithelial cells, which are the cells that line the surfaces of our organs and tissues. This includes the skin, the lining of our digestive system, and the lining of our respiratory system. Because epithelial cells are found throughout the body, carcinomas can arise in many different places. Some common examples of carcinomas include lung cancer, breast cancer, prostate cancer, and colon cancer. These cancers can be aggressive and often require a multifaceted approach to treatment. According to the National Cancer Institute, carcinomas account for about 80% of all cancer diagnoses. This high prevalence underscores the importance of understanding these cancers and promoting early detection methods.
While not as common as carcinomas, sarcomas are another important category of cancer. These cancers originate in the body's connective tissues. Connective tissues are what hold us together, providing support and structure to other tissues and organs. Sarcomas can develop in bones, muscles, cartilage, tendons, and fat. They are less common than carcinomas, but can be quite aggressive. Because they often develop deep within the body, they can be harder to detect in their early stages. The Journal of Surgical Oncology reports that sarcomas account for about 1% of all adult cancers and about 15% of cancers in children. This difference in prevalence between adults and children highlights the need for age-specific cancer awareness and research.
Section 4. Leukemia, the blood cancer. Leukemia is a complex and often misunderstood disease that affects the very essence of our body's life-giving system. Leukemia is a cancer of the blood, a term that encompasses a variety of disorders that affect the blood and bone marrow. It is a broad category that includes several different types of blood cancers, each with its own unique characteristics and challenges. Unlike carcinomas and sarcomas, which form solid tumors, leukemia does not. This distinction is crucial because it means that leukemia cells are dispersed throughout the bloodstream and bone marrow, making it more challenging to target and treat. It starts in the bone marrow, the spongy tissue inside our bones where blood cells are made. The bone marrow is a vital part of our body's hematopoietic system, responsible for producing red blood cells, white blood cells, and platelets. When leukemia strikes, the bone marrow produces abnormal white blood cells, called leukemia cells. These cells are not only abnormal in appearance, but also in function, disrupting the delicate balance of our blood system. These leukemia cells are abnormal in 2 key ways. They grow uncontrollably, and they don't die off like normal cells. This unchecked growth leads to a cascade of problems within the body. This leads to an overabundance of leukemia cells, which crowd out healthy blood cells and impair the blood's ability to function properly. The overcrowding of these malignant cells can cause a range of symptoms, from fatigue and infections to more severe complications. The American Society of Hematology estimates that over 170,000 new cases of leukemia are diagnosed each year in the United States. This staggering number highlights the prevalence of the disease and the urgent need for continued research and advancements in treatment. This number serves as a stark reminder of the impact this disease has on individuals, families, and communities. The journey of a leukemia patient is often fraught with emotional and physical challenges, requiring a strong support system and access to comprehensive medical care. Families and communities play a crucial role in providing the necessary support and resources to help patients navigate their treatment and recovery. Advances in medical research have led to the development of new treatments and therapies that offer hope to those affected by leukemia. From targeted therapies to immunotherapies, the landscape of leukemia treatment is continually evolving, bringing new possibilities for remission and cure. Survivors of leukemia often share their stories to inspire others and raise awareness about the disease. Fundraising events and community initiatives play a vital role in supporting research and providing resources for patients and their families. Together, we can make a difference in the fight against leukemia. bringing hope and healing to those affected by this challenging disease.
Section 5. Lymphomas. Cancers of the immune system. Lymphomas are a group of blood cancers that develop in the lymphatic system, which is a crucial part of the body's immune system. This system includes a network of vessels, tissues, and organs that help to filter waste and fight infections. The lymphatic system is composed of lymph nodes, spleen, thymus gland, and bone marrow. It plays a vital role in maintaining the body's fluid balance and defending against infections. Lymph nodes, small bean-shaped structures, are scattered throughout the body and act as filters for harmful substances. Lymphomas develop in lymphocytes, a type of white blood cell that plays a key role in the immune response. These lymphocytes travel through the lymphatic system and the bloodstream, helping the body to fight off infections and diseases. When lymphocytes become cancerous, they multiply uncontrollably and can form tumors in lymph nodes or other parts of the lymphatic system. This can lead to a weakened immune system and an inability to effectively combat infections. There are two main types of lymphoma: Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is characterized by the presence of Reed-Sternberg cells, which are large, abnormal lymphocytes. Non-Hodgkin lymphoma, on the other hand, encompasses a diverse group of lymphomas that do not have Reed-Sternberg cells. Both types can cause a variety of symptoms, including swollen lymph nodes, fatigue, and weight loss. Other symptoms may include fever, night sweats, and itching. These symptoms can often be mistaken for other illnesses, making early diagnosis challenging. Treatment approaches vary depending on the type and stage of lymphoma. Common treatments include chemotherapy, radiation therapy, immunotherapy, and targeted therapy. In some cases, a stem cell transplant may be necessary to replace damaged bone marrow with healthy cells. The Lymphoma Research Foundation states that approximately 90,000 people are diagnosed with lymphoma each year in the United States. This statistic highlights the importance of awareness, early detection, and research in improving outcomes for those affected by this disease. This statistic shows that lymphomas, while less common than some other cancers, still pose a significant health concern. Ongoing research and advancements in treatment are crucial in the fight against lymphomas, offering hope for better survival rates and quality of life for patients.
Section 6. Melanoma, the skin cancer. Melanoma is a serious and potentially life-threatening form of skin cancer that requires our utmost attention and awareness. Melanoma is a type of skin cancer that develops in melanocytes, the cells that produce melanin, the pigment that gives our skin its color. These melanocytes can become cancerous and form melanoma, which can appear as a new mole or a change in an existing mole. It can occur anywhere on the body, but it is most commonly found on areas that have been exposed to the sun, such as the back, legs, arms, and face. While melanoma is less common than other types of skin cancer, it is more likely to spread to other parts of the body, making it particularly dangerous. This ability to metastasize or spread to other organs and tissues is what makes melanoma so deadly. Early detection and treatment are crucial to prevent the spread and improve the chances of a successful outcome. Exposure to ultraviolet radiation from the sun or tanning beds is a major risk factor for melanoma. Ultraviolet (UV) radiation damages the DNA in our skin cells, which can lead to mutations and the development of cancer. It is important to protect our skin by using sunscreen, wearing protective clothing, and avoiding excessive sun exposure, especially during peak hours. Other risk factors include having fair skin, a history of sunburns, and a family history of melanoma. People with fair skin have less melanin, which provides some protection against UV radiation. A history of severe sunburns, particularly during childhood, can significantly increase the risk of developing melanoma later in life. Additionally, having a close relative with melanoma can also increase one's risk, suggesting a genetic predisposition to the disease. Early detection is crucial for successful treatment. Regular skin checks by a dermatologist and self-examinations can help identify suspicious moles or changes in the skin early on. If a suspicious lesion is found, a biopsy can be performed to determine if it is melanoma. Early-stage melanomas can often be treated successfully with surgery alone, while more advanced cases may require additional treatments such as immunotherapy, targeted therapy, or radiation. The Skin Cancer Foundation reports that melanoma rates have been rising for the past 30 years. This increase is likely due to a combination of factors, including increased sun exposure, the popularity of tanning beds, and better detection methods. The rising rates highlight the need for continued public education and awareness about the dangers of UV radiation and the importance of regular skin checks. This alarming trend emphasizes the importance of sun safety and regular skin checks. By taking proactive steps to protect our skin and detect melanoma early, we can reduce the risk of this potentially deadly disease. Remember to apply sunscreen, seek shade, wear protective clothing, and perform regular self-examinations to catch any changes in your skin as early as possible.
Section 7. Understanding cancer for prevention. Cancer is a complex group of diseases with the potential to affect anyone. By understanding the 5 main types, carcinomas, sarcomas, leukemia, lymphomas, and melanoma, we can be more proactive about our health. This knowledge empowers us to make informed decisions about prevention and early detection. From regular screenings to lifestyle choices, we can take steps to reduce our risk and improve our chances of a healthier future. Remember, knowledge is power. By understanding cancer, we can take charge of our health and work towards a future free from its grip.